Welcome back to another episode of Excuse My Grandma. It's Kim and my co-host,
Grandma Gail. All right, what's on the subject today, Kim?
So we are talking to a gynecologist all about the different forms of birth control, the history of it, just if you're interested of like how far we've really come in sexual and reproductive health. And it's also an episode, I think, for men because you should know what is going on for heterosexual men, what is going on in their partners' lives. If your girlfriend's ever talking about birth control, you should be aware of these things. I don't think ignorance is bliss.
Well, I also think that men have responsibility with contraceptives as well, and yes. I'm sure the doctor's going to talk about that as well. So it applies to everybody who's either in a reproductive cycle or a grandparent or a parent whose child is going through it. It's informative. You know, Kim, I was thinking, young people going out today, even people who are going to college, who are in their 19, 18, 20, 21-year-olds, are having sex, but who brings up the conversation of what are you using? I mean, is that a conversation or is that something at the spur of the moment, just somebody pulls out of their pocket and has a condom?
Yeah. You know what's crazy? Unfortunately, I don't think anybody has these conversations in a mature way.
Well, of course, because they're all at drunken parties in college.
Yeah, I mean, you're either drunk or you're nervous or you're, whatever it is, or you're immature. And I don't even, honestly, I think in college, it's almost probably better than, in my friends' experiences than now because you're taking sex education and things when you're younger. It's so top of mind. Everyone's warning you all the time. I think later in life, people aren't thinking about it as much. I know a lot of the times there won't be any conversation.
That's scary.
It is scary.
Because, especially with all these dating apps that we constantly are talking about, and you're meeting people that you really don't know, or you don't know where they come from.
So whose job is it? Let's say a guy's not bringing it up. Like, let's say you're making out and then he doesn't pull out a condom, but sex is going to happen. Like, you have to say something, I guess.
Well, I think the job is of both people. If you're in your 20s or 30s and you're going out with somebody either for the first or second time and there is sex involved at the end of the evening, either the woman has to certainly be on some form of contraceptive methods, or I think, because I think you have to use both anyway. I think you have to say, listen, I'm dying to have sex with you. I know this is where it's going, but I hope you have a condom with you.
Yeah, you have to say something. Especially as you're saying, especially if you are not on any form of birth control. I think it's people think it's funny to be like, oh, I use the pull-out method.
No, that's Russian roulette. That's a joke.
It's not funny.
And nobody wants, certainly in their 20s and 30s, nobody wants an unwanted pregnancy.
No.
Birth of a child is a beautiful moment between two people or even a single person if they're having a child. But it's not when it's not planned.
Yeah.
And so I think people have to really, if they're going out with somebody at some point in the evening over the second glass of wine, say, listen, if we're going back to the apartment, somebody better have a condom on them.
And something we actually, I don't think are going to discuss with the doctor, but it's also very relevant, is Plan B. Do you know
what?
Plan B is the morning after pill.
Well, that's, I thought, only used for rape.
No.
That's used.
I have plenty of friends who were like, oops, forgot, and they take Plan B.
And that wasn't the original
and you can
concept.
Take it. I know people who take it a lot, and I think that's actually really bad for you to take it more than once.
Oh, you know what? I'm sure any of those kind of things, because it basically does something that
I mean, you'd rather do that though
than pregnant,
right?
Yeah, no question. But I think that's supposed to be for emergency use.
And this is actually a really interesting conversation. So many people have told me stories about this, and I wish I remembered the exact thing. But a lot of the times, they'll have sex with someone, didn't use protection, and then they'll call up the guy and be like, can you pay for my morning after pill? And not.
Well, you know what? These girls are too stupid for words.
I know.
How much is this pill?
$60 maybe?
Oh my God. First of all, if the girl can't afford it, she should go buy a box of condoms and keep them in her apartment.
I know. So, why are you making the guy pay for it? Then they get offended when they don't pay for it. I've so many stories about this that are just crazy.
I think these girls better grow up.
No, and sorry, and not even just a lot of my guy friends too will be like, these girls are texting me being like, can you buy my Plan B? Like it's not just, it comes from both sides.
Oh, wow. Well,
Yeah.
glad I'm not going through this anymore. I think we should cut this conversation off and go to speak to the doctor.
Yeah, the medical authority on all of this,
Okay.
Dr. Fiss. We are joined by Dr. Caitlin Fiss, OBGYN. Dr. Fiss, thank you so much for joining us.
Thank you, doctor. We have lots of questions today.
My pleasure. Fire away.
I'm really happy that we're finally having this discussion on the podcast because we talk so much about generational differences. And when it comes to sexual and reproductive health, so much I feel like has changed, especially with open discussions around birth control, abortion, STIs.
I think you left out something. Where did you go to undergraduate? Where did you go to medical school? I love to always do that because I look on her pictures on the wall and I'm always interested before we get in the conversation.
Okay, so I went to Tufts undergrad.
Oh.
Was pre-med when I got to college, but then I started exploring more of a liberal arts education at Tufts, and they were really encouraging that back in the 80s. So I ended up being an English major at college. And then after college, I was working and decided, no, I really wanted to listen to my heart and go into medicine as I always had wanted to. And I went back to Columbia and did what's called a post-bac pre-med program. So after college, all the pre-med prerequisites in a short period of time. And then I went to Brown for medical school, trained at Mount Sinai residency, and I was on faculty at Cornell Medical School for 8 years, and then went back to Mount Sinai.
So going back a little bit, talking about taboo with these kind of topics, why do you think it's more widely discussed now than before?
Well, from my perspective, I don't know, the doctor would know this because she's the same age as my daughter, or similar. We just didn't talk about sex. Sex was not taught in school, really. It wasn't discussed at the dinner table. And it was really, you got married and had sex. So anybody who was having sex prior, because contraceptives weren't as widely used, certainly not birth control. There was no birth control in the 50s, and that came much later. There were always things that were around for contraception, but the truth is it wasn't a subject that we talked about openly. It was it was a much more proper society. People was very puritanical, and the girls who got in trouble, and that usually ended up in an early marriage or no marriage, and they became a single parent, and their parents took care of the child as well as they could. So it's different.
So Gail, then when you were raising your children, were you able to have those open conversations, never having had that experience?
Yes. No, that by the time my kids were in the 80s going to college, and we had the discussion, and I wouldn't send my daughter to college without her discussing some kind of birth control methods. And of course, she met her husband the first day of school, so it didn't matter. I mean, whatever they used seemed to work 32 years later. My son was a different issue because he was much later. And we did talk about it. We talked about it to be safe. In other words, there were diseases going around that nobody wanted to get. So that was a conversation. We didn't have that. Nobody, I don't know, in the 50s ever knew about herpes, or if they knew about it, it was something under the table and no one ever discussed. All venereal diseases were always, I'm sure, around, but we really didn't openly discuss it. By the time my kids were in school, that was an open conversation, but we didn't have the wonderful vaccines that you got, have today for young teenagers not to have certain illnesses. So it was a different type of society, and sex was reserved for when you got a little older. I don't think teenage sex in the 50s and early 60s was that prevalent. I might be wrong, but certainly in the world I came from, in a suburban area outside of New York City, it really was not a conversation that really ever happened.
I think I give you a lot of credit, because I think a lot of women your age who never had that conversation with their parents then did not know how to have that conversation with their daughters and their sons. And so I think everything was very slow to evolve. The birth control pill was developed in the 50s. I think HIV played a big movement in bringing conversation, people being able to say the term condom into conversation without cringing and running away. And I will say that I give the gay men a lot of credit, because they came right out, and then we started to make condoms accessible, and you would find condoms machines in installed
Bathrooms.
public spaces, and people started to use the word condom more openly. And I think that is something that was that we learned about and gained through the AIDS crisis, because we didn't know in the 80s what HIV and AIDS were and how it was transmitted. And as we started to learn in the early 80s and in the late 80s, it kind of came in much more into conversation to be able to talk about condoms.
So that conversation around condoms, and then you said the pill was in the 50s, and then what other, I guess the IUD?
So I would say around 2000, we started using it much more liberally. Initially, they were marketed towards women who had already had children. We had a great result with that. The IUDs with the progesterone, now initially there was only one dose fits all. Now we have 3 different doses and different lengths of time that they last. I would say 18 to 28-year-olds are some of the people that are using the IUDs the most.
So you would really recommend that for college young women as a birth control, or would you rather them go on a pill, or is there no difference anymore?
It's a great question. That's a great question. And I think I take it patient by patient. So taking a pill is a responsibility. You have to be committed to it. You have to take your pill every single day. We're using very low dose pills. So the original pill that came out had 50 micrograms of ethinyl estradiol. That's the estrogen part of the pill. When we talk about combined pills, that means it has estrogen and progesterone in it. And there's hundreds of pills on the market nowadays. And the reason they differ is either in the dose of estrogen or the type of progesterone that they use. So you can play around with both ingredients to find the perfect match for each patient. Some people have a medical reason that they cannot be on a birth control pill. The reason you have to go to a doctor to get a prescription for a birth control pill, and there is a movement to make pills over the counter and be able to buy them just like Tylenol or Advil or any kind of inflammatory. There's a movement to make them more available for women, for young women who are sexually active and don't have access to medical care.
Correct.
But the one reason that the FDA has held out on making that labeling available and making that available to the market is because of the risk of blood clot. The pill can affect people's mood, it can affect weight, it can affect menstrual cycles. So you have to pick the person very, very carefully who's going to use the pill, and you have to have, the person has to be committed to taking a pill every single day at the same time.
All right. That was my follow-up question. I feel like me and so many girls that I know, it was always a process to find the birth control that really worked for them. I feel like I tried a billion different pills. It really does affect your mood. And finally, I'm a Mirena spokesperson. I think it's the most brilliant invention of all time. But for people who have trouble kind of finding the one that works for them, what advice would you have? And what really is the process of that? Is it just conversations with your doctor? Do you find with patients it is trial and error a lot of the time?
I do. I find that it's a little bit trial and error. I think you have to see your doctor. The pill has other non-contraceptive benefits. So some of the benefits are it's excellent for skin. So if you have acne, you might choose one pill with a certain type of progesterone in it that would be better for skin. The truth of the matter is they're all great for skin. All of the combination pills are great for skin, not so much with the progesterone only pills, but the combination pills are all good for skin. Mood is very person to person. For some people, the pill is stabilizing, and actually it's recommended as treatment for PMS, which is premenstrual syndrome. It's hormonal. And if you take a monophasic pill, meaning the type of pill that has the same dose of medication every single day through the active pills through the month, it will eventually even out your mood. So you won't have the natural ebb and flow of hormones that is part of the natural cycle. So you kind of have to have a conversation with a healthcare provider.
This is the problem I see with this. Just to interject, how does a young 18-year-old girl that hasn't got the ability to go to a doctor or can't afford it or whatever, and they can get the pill maybe through their local healthcare centers in their neighborhoods, this becomes an issue. And there has to be some way the FDA or some overall writing organization who has a say in this really gets to something that's good for at least almost the whole population. There's always 1% that can't tolerate it, and those people would go off it. But I still find this is how many years now the pill has been out, at least 60 years, and they still haven't got it down pat. I find it amazing with all our brilliant minds like yourself and all the other people in the profession, that they can't generalize a medication.
Meaning make one fits all, or make it
one fits, or thing that fits all, that just anybody can go in and buy.
I think that having the slight differences is part of what makes the pill so excellent, because you can tailor it for the person. I understand what you're saying. If we had one that fit everybody, yeah, there are some that I think would pretty much fit everybody, but then again, different companies and different pharmaceutical companies
are pushing different pills.
Going back to the IUD for a second, there's also a non-hormonal IUD called the Paragard, which has copper. Also troubleshot a lot of the problems that we had with the IUDs prior to the 90s. Very few complication rates, superb contraception, very much reversible. It has no hormones. You have it placed by a medical provider. Doesn't have to be a doctor. It can be a nurse practitioner and somebody trained to place that. It lasts for up 10 to even, it's now been extended to 11 and 12 years in certain places. Wow. And the only downside is because of the way it works. And the way it works is it makes a sterile inflammatory reaction in the lining of the uterus. So you build up white cells in the lining of your uterus. There's no infection, but you're building up inflammatory markers. When those shed out during your period, because there's no hormone, you still get your period on a monthly basis. The period can be heavier and a little bit crampier, and it can last a little bit longer. So for that reason, it's not that appealing to many young women. Right. There's actually a new non-hormonal method out called Phexxi. It's a gel that you insert just prior to intercourse. When used properly, the studies show it can be 93% effective in real life. So whenever you look at contraception, there's always like, how is it done in the lab when we were studying it? And then how do real life women use this method? So in real life, it came down to like 86% effective, which is sort of the same efficacy as a condom. But for people who can't take or won't take hormones, or don't have access to a doctor Phexxi is still a prescription. But if you don't have somebody that can, if you're not able to have an IUD installed, this is a great, new thing to the market. And it's been such a long time since we have new things. We do not have a male birth control pill, which is something I know they're working on. It's very, very hard to do.
See, Kimmy, you're talking about contraceptives for young people in their 20s. So this would be certainly an important thing. What about people who get older? Do we still do the same IUDs? Do we have more of a problem with?
What do you mean older, like 40s?
Well, in their 40s. I was actually thinking of almost in their 50s. Is there any increase in, let's say, because you would know, and I certainly am ignorant on the subject, in breast cancer and any of these things, or different? So because that worries me.
Typically, the average age of menopause in our country is about 51, 52. It can be younger if you have a family history of earlier menopause, or if you're a smoker. But generally, you won't get pregnant naturally after the age of 52.
Right.
There are some outliers, so always good to consult with your doctor. But generally speaking.
Even if you get your period still?
Yes, because of the age of the egg. So the egg quality goes down, so it becomes very hard to get pregnant. It's not impossible. And if you're having regular periods and you're 53, you definitely should be using contraception. I always talk with my patients about using it up to 54, 55 as needed. But that we do now use some of these low dose pills, and certainly the progesterone secreting IUDs, to help manage both family planning issues in 30s, 40s, and into the transition to menopause. So people who start to have early hot flashes, mood destabilization, mood swings, really some of those early signs of menopause are hidden and treated by the pill.
But you don't see any increase in breast cancer.
Well, that's the third thing I wanted to talk about. So we know that estrogen, exogenous estrogen, taking oral estrogen in high doses can, for long periods of time, has been linked to breast cancer. What we believe in the pill is, if you're using a very small dose of estrogen, this is why we brought the levels down significantly. So we're looking at 10 and 20 micrograms of ethinyl estradiol, and you use it for a short period of time, then we don't believe it causes breast cancer. If somebody had a risk for breast cancer, then giving them estrogen might make that breast cancer come out earlier, but we don't think it causes breast cancer in somebody who doesn't have a risk for breast cancer de novo.
Okay.
The other thing is in families who do have breast cancer and who might have genetic predisposition towards breast cancer, many of those genetic causes of breast cancer, and remember that's only 10% of breast cancers, but many of those genetic predispositions to breast cancer also have a link to ovarian cancer. And if you're on the pill for five consecutive years at a minimum, 10 is the original study, but we've also seen a benefit at 5 consecutive years of being on the birth control pill, then you have decreased your lifetime risk of ovarian cancer by 70%.
Now that people are maybe relying on other forms of birth control, are people really still using condoms as a secondary form of contraception?
It's a really good question. So I think first and foremost, condoms are being used to prevent sexually transmitted infections like HIV.
Right.
And HPV. So we now have a vaccine against human papillomavirus, this virus that's been linked to cervical cancer. That condoms is also a really good way to protect yourself from the HPV virus. Also hepatitis B, we've seen a resurgence of hepatitis C, and believe it or not, we've seen a resurgence of syphilis. So those are really the best line of protection from that. And I do think in some of these things, like if somebody said to me, I can't use any hormones for one reason or another, I don't want to use an IUD, I'm going to try Phexxi, I absolutely would tell them, given that the actual user success rate is 86%, I really think that there's a role for condoms as a backup, 100%. We recommend condoms with the birth control pill. Again, 1 in 100 women get pregnant on the pill. I mean, it's this amazing thing that when you look at that number, 1 in 100 is a challenge. So I think using condoms really increases the efficacy.
What about the IUD? How effective is that compared to the pill?
So all the IUDs are comparable. So all the IUDs on the market today, 1 in 100,000 get pregnant on that.
So good.
It's amazing. That's
Brilliant.
amazing. But it doesn't protect. And so the IUD, so if you have a progesterone secreting IUD, that some of the other benefits are it will protect from endometrial cancer, but it won't protect you from sexually transmitted disease. It may make you more likely to get pelvic inflammatory disease. It doesn't suppress your ovaries or ovulation or protect you from ovarian cancer. So there's trade-offs on everything.
Another follow-up IUD question. For people's partners who claim that they can feel the string, is that a myth? Or do you think like a guy with a high ego says that they can feel the string, or they heard someone say that?
Remember we were talking about how when they made the IUDs, they troubleshot all the issues. So the initial string was very much like a thread, and it was a braided thread, and bacteria clung to that. The string that's used now is more of a wire. It almost feels like a fishing wire, or like almost like dental floss. And it can poke a little bit. So if it gets cut very short, it can poke the person a little bit. Yeah.
No, I think actually the guy should just be quiet.
Yeah, you're lucky that you're
having sex. Stop complaining about a string. I mean, this is why I couldn't have sex today. I don't want any complaints. I'm lying in the bed. Just relax, have fun.
That's good advice. So speaking of, we're clearly very open. A lot of parents or children might not have the same relationship where it's a little harder to talk about sex, whether it's, hey, I got my period, or hey, I want to go on birth control, or hey, I might be pregnant. Any advice for both parents and as, teens or young adults, how they can speak to each other about these kinds of topics?
Well, the thing I would say to parents is the best thing you can do is just sit there and listen sometimes your child just wants to talk or ask questions without any judgment. And the minute you say something, they're going to interpret it as judgment. So try to keep, even if inside you're like, oh my God, I can't believe we're at this moment. I can't believe this is happening. And you just want to, squeeze your son or your daughter and just say, I can't believe this is happening. Just try to take a minute, take a breath, and almost have a flat, you don't want to be disinterested, but you want to give them space to talk and let them bring to you their questions, and you don't want to seem judgy. And I think the more you're open and listening, the more they will tell you and feel comfortable in telling you. For kids, I would say your parents, for the majority of kids, your parents are adults and were you at some point and are having sex or were having sex, and almost nothing you say is going to be new to them. They've heard it. So, some people are like, my mother wouldn't know what I'm talking about, or my father,
that's the case.
Well, but in a way, like with an IUD, let's say, if you say like, I want to go on this, and it might be something foreign because in the 80s, maybe, my mom didn't know what that was, then couldn't it kind of be a...
Well, no, but I think if you have an open relationship with your parents or somewhat of a conversation, of course, they're new things. Everybody realizes that. But the best thing would be if a parent could bring them to a health provider or to a doctor and have them sit down also with them and talk it over before they go away to school or before even, at any point where they think they become sexually active. Don't you think, doctor? I mean, or do you think it's better off coming first from a parent?
I think it's amazing if the parent can, take their child, but not everybody can. I'm realistic about that. And I see a lot of mother-daughter duos coming in. I see a lot of women. One time I had a patient come in and she selected her stepmom when I just thought that was incredible, right? What a nice way to honor that woman in her life. She said, I don't feel comfortable talking to my mom, but I do feel with my stepmom. But that's amazing. Not everybody has that ability to talk to their parent that way. But I would say the most successful mother-daughter pairs that come in to talk about contraception for me are the ones where the mom sits back and lets the daughter be the adult in the room. You're going to be having a sexual relationship with another person. That is a very adult moment for a teenager or a young adult. And so let them sort of be the adult in the room. And so I think it's nice if the healthcare provider can include the parent in the conversation.
Oh, I wanted to know, are birth rates going down? If you look at your clients, you see that people are having less children nowadays.
Yes. So we were actually, as a country, we were down even in 2019 before the pandemic, we were down. And now through the pandemic, a lot of people thought like everybody was home having sex, but not so during this pandemic. People were scared. And
they're getting divorced.
Some people got divorced as a result of being in quarantine.
In the room too much.
Yeah. I think people who had small children and were home locked in their house with their small kids who couldn't get vaccinated were like, this is not the moment to have another baby. I think people were scared to get, sick, to get COVID during pregnancy. Women who are pregnant are 2 times as likely to have serious complications of COVID. And they were scared to get the vaccine in pregnancy. So the whole thing, there's definitely been a dip. Nationally, we're down 500,000 births.
Oh, wow.
You can feel it even in our hospital. I'm in one hospital of all the many hospitals in New York, and in our hospital we're down 800 births. And you actually feel it when you walk in, like the nursery, there's fewer babies in the nursery. There's
that's sad.
Baby beds available. You can feel it. So yes, I think we were trending that way because of all these options for birth control. I think people were delaying pregnancy because for many, many reasons.
Right.
And I think also, getting pregnant in your mid to late 30s was also more acceptable.
But isn't it more difficult to get pregnant? As women have decided to go into the workforce much more readily and don't want to give up their careers, they're starting to have families later on. It's a little more, that's why all the fertility clinics had such an upswing in recent years. So could that, the ability to get pregnant isn't so easy after a certain age either.
It's harder to get pregnant naturally, but our fertility has become more accepted and some insurance plans cover it. So people are willing to seek assistance for reproductive technology much more readily. And I also think there's more testing available so that for the older parent conceiving, the risks of having children with what we call, with genetic complications, there's options on the other side of that. So I think that for a myriad of reasons, people are having babies later. There's more options and healthy babies and wonderful babies. And that's been great.
Dr. Fiss, thank you so much.
You were terrific. You were
Thanks.
terrific.
If people want to look you up and come and see you, how can they get in touch?
Well, it's Carnegie Hill OB/GYN is my practice. Where you can look us up, CarnegieHillOBGYN.com. Also in New York, I'm under Caitlin Fiss, MD. Happy to accept new patients, and I'd love to see.
Thank you so much.
And you started out as an English major like Kimberly. Now she should go back to medical school.
There's always time.
There's always time. That's right.
I hope you guys enjoyed our conversation with Dr. Fiss. What do you think, Grandma?
Well, I think she's certainly brilliant, and she knows her job. Some of it was a little technical for our audience, but you know what? It's an education, and people have to really advise their children and their grandchildren about safe sex and how and what to do for themselves, because it's too out there. Everybody is doing it. It's not like it's being held for marriage anymore. So we have to be intelligent about it.
Okay, let's do our 1950s movie of the week.
Well, I think actually I was thinking about this after we heard from the doctor. What about Cheaper by the Dozen?
Yeah, so that was 1950. You guys probably know the 2003 version with Steve Martin, but this was the original family with 12 kids, right?
I guess, and it was fun, and it's fun to watch. It's cute. It's something that would never happen today, but it's an adorable.
Well, no,
little
you never
story.
know. There's like Kate plus 8, Octomom.
All right, that's what it is. 1 in a trillion now.
Another great episode of Excuse My Grandma. You know how to follow us on Instagram and TikTok at Excuse My Grandma. Please leave a review and rate our podcast 5 stars. Also, if you haven't seen our Rachel Ray interview, because we haven't plugged that on the podcast yet. We did a segment with her. Please check that out. You can go to our Instagram for the full thing. That's at Excuse My Grandma, or you can search on YouTube Excuse My Grandma Rachel Ray. And have a great week.